All right, my name is Greg Ferenstein. This is a panel about regulation, bills, future legalization initiatives. I'm going to let the panelists introduce themselves. I'm CEO of Frederick Research. We're a public affairs firm in psychedelics industry.
My name is Ryan Munevar. I'm the campaign director for Decriminalize California.
Good morning. I'm Juliana Mercer, and I'm the advisor for Healing Breakthrough, Veteran Advocacy, and Public Policy.
I'm Melissa Lavasani. I'm CEO of Psychedelic Medicine Coalition.
Okay, great. So first round of questions, kind of lightning round, this is like self-promotion territory. What are you working on in the near term that you think would have the most impact? And very briefly, make the case.
Currently, we're working on the California psilocybin initiative, which would allow for the cultivation, manufacturing, distribution, possession, transport, consumption, analytical testing of an unlimited amount of psilocybin-infused products and magic mushrooms for anyone in California over the age of 21. We're at 33% of the target goal of 546,000 signatures, and we have approximately around 2 months to go.
So I'm working specifically on getting MDMA into the VA for all veterans that can benefit from it for PTSD.
And we are working on creating multiple streams of funding, federal funding within the government. So our next big push this year, there's $15 million that's going to the Department of Defense for psychedelics research. Next year, we're going for $100 million in research funding to go to agencies like NIH, DOD, BARDA, ARPA-H, a lot of acronyms that probably most people don't know, but lots of healthcare, lots of defense research, but really creating a base of funding that the psychedelic ecosystem can partner with the federal government, not have an antagonistic relationship with the federal government, but really work with them, meet the federal government where they are on this issue, and build the body of data that lawmakers are looking for to make meaningful policy change in the future.
All right, most of our job as lobbyists, advocates, however you want to call yourself, is persuading people. I am curious, what is your most persuasive, it could be argument, could be experience, whatever it is, for Democrats and Republicans down the line?
Yeah, I can start. So I'm a Marine Corps veteran. I personally healed through psychedelics. I was lucky enough to connect with a nonprofit, Heroic Hearts Project, to get my own healing outside of the country, which I served. So going into legislators' offices on both sides of the aisle, telling them that our veterans are leaving the country to get the healing that they deserve is very persuasive. And telling them that they owe it to us to make these types of therapies available here at home. But the other very persuasive thing is that veterans are suffering from PTSD, and we're losing over 6,000 veterans a year. We lost less than that in 20 years of conflict. We're losing more veterans every year than we did in 20 years of conflict. That's 114,000 veterans to date, compared to the less than 6,000 that we lost in combat. Finding a solution, MDMA is 71% effective in eliminating a PTSD diagnosis. So when we walk into a legislator's office, most of them have been trying to find solutions for the veteran suicide epidemic. When we tell them that there's a solution that works for 2/3 of the people that go through the therapy, they want to get behind it.
Our argument is the same, whether it's Democrats or Republicans. I feel like it's an even playing field right now. My personal story is one that I usually open with. I'm a professional working mother who had terrible postpartum depression, and I used psilocybin that I grew in my home to help cure myself from postpartum depression. The entire process was extremely difficult for me personally because I'm not a scientist. I was guessing about what I was doing. I was scared to tell my therapist what I was doing. So it was very much trial and error. I'm very fortunate it worked out for me, but So many people are exploring psychedelics on their own, and the federal government needs to create this as a part of our healthcare system, so we have safety protocols, that we have evidence-driven solutions to this, so we can really build the body of data that needs to exist with the most, create the federal funding so that we can create the most objective data we possibly can, so that we can slowly start to integrate this into our healthcare system, because our mental health care system, our addiction system is completely broken. Nothing is working, and I think no lawmaker can deny that. And obviously, like piggybacking off what Juliana said, using veteran stories has been very effective for both sides of the aisle, because they really both need to be brought up to speed on what the potential is. And then showing them the not preliminary, there's a big body of data that already exists that supports psychedelics as being potentially extremely effective for so many indications. So referencing that as much as possible, and really encouraging them to get behind federal funding as a first step to this has been extremely effective.
In California, we really like our drugs, basically. And if you look at the state's composition, politically, it's basically 2 blue Democrats to 1 red Republican to a purple undecided. And we looked at the math to actually figure out where to go first, and then with the 5 basic pitches that we have, it goes like this. Medically, there may be something biologically wrong with you that you feel this substance can help you. Therapeutically, you may be traumatized from a series of events. You may have been a veteran. You may have seen your friends killed. You may be a first responder. When it comes to the religious component, some people, they already attach this as part of their ancestral heritage that goes back before their recorded history. And then people that are spiritual, that are out there and discover this stuff on the playa, they find it. They don't necessarily want a form of organized religion, but they do feel there's something up above them. And then the 5th one is actually freedom of choice. Basically, it's your body, it's your property. You have a right to choose to do with this, whether it's good or bad, regardless of what society thinks. And if you do a straw poll in a room of about 100 people in California on average, for not the only reason, but like the primary reason why they do it, you'll get about 5 hands that go up for medical, you get 5 hands go up for therapeutic, you get like 2 to 3 for religious and 2 to 3 for the spiritual side, but the other 85% of the 85 people in the room are basically freedom of choice, and then they can customize it as they so choose, and that's what we focus on.
Yeah, and Playa is shorthand for people who go to Burning Man. So I'm a senior fellow at the Reason Foundation, and I find that I interact with a lot of Republicans on this issue, and I find that most of the Republicans are pretty libertarian when it comes to drug policy, especially the legislators. And if you can tell them that the federal government is getting in the way of something that saves people's lives, especially just bad regulation, that generally is pretty persuasive. Democrats have a real love of agencies, and if you can tell them that you can create an agency that will allow some kind of regulated marketplace, and it'll be safe, and it'll be effective, and better than the black market, and it'll help achieve equity and the other things that they care about, that I find that is pretty persuasive for them as well. Let's see. All right. Blue sky. If you were like king, if the United States instituted a king or queen, and you could pass any regulation you wanted, whatever you wanted, blue sky, what would it be? And then, practically speaking, how much would it cost?
Can I take this one? Basically, I would push for the citizens initiative process in all 50 states and the District of Columbia, and I would allow people to choose, and I would turn on the initiative, referendum, and recall process, and I would also drop the threshold to qualify to about 1%, and anyone that even applied for an initiative would go out in like a voter mail packet, like, you know, when you get your ballot book and it has a list of all the different things coming down the line, I would do that, and then they could just go down it like a Chinese menu to select whatever they want. Otherwise, for example, if you were to try to, let's say, end a horrible law, it's impossible to do it at the federal level as a citizen. You basically can only go through lobbying entities. So, yeah, that's what I would do.
Okay, we have extreme direct democracy as one. Bold.
I think that if we're healed, we'll be able to make better choices for each other. We're going to vote differently. So giving people the freedom and the option to choose whatever medicines that they want to use to heal would be my big blue sky dream.
So, no regulation. All right.
Healthy regulation. Obviously, rescheduling is a major, scheduling of these drugs is a major barrier to so many things. So I think if I could choose anything I wanted right now, I would reschedule all psychedelics and take an entire look at the CSA and review that and figure out a system that actually works for the people. And that entail would create a snowball effect of research funding, drugs getting coming to the marketplace. As far as cost goes, it'd be covered by insurance, so hopefully none of us would really have to worry about it.
All right, get rid of the Controlled Substances Act. Let's see. So I think it's fair to say anyone coming to this conference knows that the industry is struggling, right? Businesses are struggling. From a regulation perspective, A, do you think regulations and laws are one of the primary reasons that the industry is struggling? And short term, if you could get rid or change one law, what do you think is necessary so people can start making money?
I mean, obviously the rescheduling is a major piece of why it's so incredibly difficult to work with psychedelics. And I think the industry is struggling for multiple reasons. I mean, obviously, like the economy plays a very big role in that, and investor funding is where it was once flowing like water, and psychedelic companies were getting crazy valuations, and a lot of money was flowing. I think there was the economy kind of, the tech boom and the crypto crash kind of corrected it, and there was I don't want to say a culling of the herd, but like the psychedelic space needed to get, the industry itself needed to get smarter and leaner and more efficient, and really rethink what the path forward is. And I forgot your question. What was the rest of it?
What regulation do you think
Yeah.
needs to happen? So in this case,
Yes,
it's
the
really
rescheduling.
it's reform the Controlled Substances Act.
Yes, absolutely,
And
absolutely.
specifically, so for folks who don't know the Controlled Substances Act, what about the Controlled Substances Act makes it so difficult to make money?
I mean, there's just extreme, when you're in Schedule 1, there are extra steps you have to go through to research psychedelics. So it's extremely expensive, it's extremely cumbersome to go through. It's like a 2-year process to even touch the stuff. So there's very high barrier to entry when you're dealing with Schedule 1 substances, and that very much hinders the science and thus hinders everything else from happening. So the CSA is a very big barrier that we have yet to cross, and a lot of the holdup with that. I think that the government is interested in looking at that. They know the war on drugs is a failed policy. They're aware that Schedule 1 is a potential issue for this, but politically, cannabis is ahead of us, and rescheduling is a very difficult task to take on when cannabis rescheduling has been a topic of discussion for so many years that the government just can't seem to move on. So once that kind of barrier is removed from our way, I think the rescheduling conversations become much more relevant.
Everything Melissa said is spot on.
I would say back in 2015, I pushed an open source draft initiative in the city of Salinas, and we turned on for cultivation manufacturing one analytical lab. And at the time, I thought research was going to be the key in order to sway all the politicians out there. So I created a company called Cannabis Research Consultants. And then what I discovered after submitting hundreds of documents showing pro-cannabis-based research, honestly, most of it came out of Israel at the time because that's where the best work was being done. Politicians, I mean, they really didn't give a fuck, in my experience, at least at the city and county level. And the state level, a lot of them went up there and they still didn't give a fuck about it. But what they did care about was making money off of taxes. And when we changed the name from Cannabis Research Consultants to Cannabis Permits, we ended up permitting over 1 million square feet of commercial greenhouse alone, like 9 dispensaries, over a dozen mobile delivery services, 1 analytical lab. And what they cared about was the taxes. And if they can regulate and tax you at every single point, they become very happy. But it's like a dog that tastes human blood. Once they get that in their mouth, they never let go of it. So I honestly think the cannabis industry unfortunately trained politicians that this is a cash cow that they can just dip into whenever they want. And as difficult as it is right now in order to do research because of all the restrictions that are out there, I think the next major problem is just going to simply be over-regulation and over-taxation. So that's what I'd be looking out for.
So here's a question for the folks. So I'm curious, what regulations do you think would be necessary to compete with the black market? So for instance, Juliana, a lot of veterans, they go to Mexico. When the FDA approves MDMA, psilocybin, potentially ibogaine, do you think it's going to be worth the time for vets to actually go to an American clinic? And if not, what has to happen?
I don't think that there's one right-size-fits-all solution, so I think that both are going to still be there. So even once it's medically approved and medically available, there's still going to be people that want to do it in a ceremonial way outside of the clinical setting. So I don't think we're ever going to get rid of the black market unless it's all legal and all okay for us to use. So I believe that veterans are still going to go to other countries. They're still going to use them underground here. And not just veterans, I think everyone is still going to continue to do that. But there's also people in our communities that only will do it if it's legal. And there's people that are suffering, waiting for it to be available to them in a medical setting. So being able to create that and give people access that normally wouldn't go underground is something that's going to help a lot of people.
One thing I'm curious about in your guys' experience, because Colorado did legalize, if you're not familiar, Proposition 122 last year legalized personal possession of botanical psychedelics, and then started a project to then have a therapeutic framework. Why don't you think, why aren't more people going to Colorado? Like, what's the regulations that's preventing more businesses going to Colorado and setting up shop now that it is legal in one U.S. state?
Because I don't think there's as much money in it as people would like to think that there is. And in Colorado, the way things work, yeah, you would compete against the black market, but most of the people came from the black market and are trying to make a transition through to the gray market. And if you actually have a company and you want to make a lot of money, there are a couple of huge restrictions because the way the laws work. For example, banks won't work with you because they're FDIC insured, and they don't want to lose their insurance dealing with a company that does Schedule I substances. And I know a lot of people are here into the retreat process, but unfortunately, that's, in my opinion, not the greatest business model. If you take in comparison, 6 years ago, I used to probably get about 2 to 3 business proposals a week for cannabis bed and breakfasts. You know, you show up, they give you a little mint, it's infused, and they put a little lay of like buds around you when you show up, and people are like, oh, this is amazing. But it's like, why am I going to spend an extra $1,000 a night when I could just smoke weed in my living room? So I think competing against the black market, it's so much cheaper, it's so much easier, and these things are easy to produce. Other substances, though, that require a lab, such as MDMA or LSD, that's going to take a higher level of skill sets to pull that off. That's probably something that's more marketable in the future as far as business models. But then again, take into account, if you look at Amazon is now the world's largest lobbying entity for cannabis. And it's easy to let everybody else do all the groundwork for the setup of it, but all they want to do is basically allow for it to ship. And at that point, if, for example, you try to get into the cannabis space and you want to become a distribution company, do you really want to go up against Amazon? I mean, I wouldn't.
Yeah, same thing, Juliana, like ibogaine, mescaline, that's cactus. Why aren't a lot more vets or folks that you know flying down to Colorado for treatment, or are they?
So I know Heroic Hearts Project is going to host their very first in-country retreat in Oregon in a couple of months, I think maybe next month. So we are starting to do that because Oregon is allowing for that. I'm sure that we're going to be doing it in Colorado soon as well. I don't know how set up Colorado is yet. I'm not familiar with how they've set things up and if it's something that they can do already, but we are doing that.
Get someone from the audience, but Melissa, please.
Also important to acknowledge that while Oregon and Colorado are creating legal access models, a chunk of American population can't really afford to fly across the country and do this, and quite frankly, could be uncomfortable doing psychedelics in that kind of setting outside of the medical healthcare system. So while people can access through those states, I think it's not a one-size-fits-all. I think a lot of Americans, especially on the conservative side of this country, would be more willing to try a psychedelic that, was in a healthcare setting, that they felt safe, their doctors were informed, they were prepared properly, they had integration services afterwards, it was covered by insurance. Putting psychedelics into our current healthcare paradigm and adapting our current healthcare paradigm to support this kind of care is really important for access for Americans, as not everyone would want to go to a clinic in Oregon, or they want to have a doctor around because they are dealing with serious issues.
We had a hand raised in the audience.
Thanks, Greg. My name is Matt Brockmeyer. I'm an attorney in Colorado, and I'm working with the Natural Medicine Advisory Board on rulemaking, so I figured I might give an update real quick.
Briefly, but yes.
Briefly. So we did legalize 5 plant medicines: psilocybin, psilocin, DMT, mescaline, not from peyote, and ibogaine for personal use in November under the NMHA. The legislature came and repealed and replaced that law with a Senate bill that substantially it kept most of the law intact, thankfully, because the community rallied and supported the bill that we had just passed. But the personal use provisions went live at the beginning of this year, but there's basically a 2-year lag for the regulated program. And so the rulemaking is still happening in earnest because we have about a year to get it done. And then I believe you'll see a lot more institutional clients, the retreats, the healing centers with kind of a little bit of financing come in. In the meantime, the state did explicitly allow for the support and education around another person's personal use. So basically like small, ceremonial, community-based businesses are allowed to operate in the space without a license. They just can't advertise or provide the medicine to their clients. So it's a different paradigm. I think Melissa's absolutely correct that we need to meet people where they are. So if folks are more conservative and more comfortable in a more medical setting, then we should build that for them. But that shouldn't be the only route. Okay.
Thank you. The other thing I'll say about Colorado is the law doesn't allow sales. So you can't have a business, you really can't, because unless people are going to grow their own mushrooms or their own San Pedro, you can't sell it to people, and that's a very difficult business model. And even if people do find ways to get around that, you can't have a major business, so it really only allows very small-time businesses because they can grow a personal amount of psychedelics, and that's all they can have at any given time. So there's no venture-funded prospects anywhere in Colorado now, or potentially in the future, depending on what Colorado allows for a therapeutic model. Any other questions? We have like 3 minutes. Any other questions from the audience? Otherwise, we'll talk more.
Oh, come on up. This is The Price is Right.
Hi, thank you for being here, guys. Just quickly, you mentioned that there was $40 million that was being given towards research that was just recently approved at the beginning of the panel, or some sort of research that was going to go towards
15 million.
15 million,
Yes.
sorry. So we already have institutions doing a fair amount of very persuasive research. Hopkins, UC System, Berkeley, et cetera. And we know that there's persuasive medical research and benefits. So I'm wondering what further research do you think we need to show to move the needle for the government?
Well, you got to think about who's funding that research. What's the money behind it? I'm not saying that that's not compelling. reference that research very frequently in our conversations with members of Congress. But what they want to see is that federally funded data, because in their eyes, that data is outside of any outside influence. There's no investor interests behind there. There's no philanthropic interests behind there. It is the federal government putting neutral dollars toward this research, which has no influence on it, and building the most objective body of data that we can. And that was probably the biggest argument against, and what's really holding back cannabis reform on a federal level is the fact that so many advocates went to the Hill, told their personal stories of all the benefits that they've reaped from cannabis, and that those anecdotal stories are very powerful. Me and Juliana, I'm sure Ryan uses it. We use anecdotal evidence in our discussions with members of Congress, but we also need the hard science to back it. And the federal government is really not going to move on this issue until there's federal dollars going to it.
So there's currently 7 trials happening in the VA system for MDMA. Those are individual trials at individual clinics, and they're being funded by philanthropic dollars. So what we're working on is getting federal funding and government skin in the game to do a national rollout of trials in the VA so that they can roll out a national program to give MDMA to veterans as soon as it's MDA approved or FDA approved. But without the national program, without federal support, we're not going to be able to execute it effectively.
Ryan,
What is the exact question?
what more research do you think is needed to be persuasive? Of course, you're dealing with
In
voters.
30 seconds. Okay.
Do voters care about more research?
No. I don't think they really do that much. What they want is access to the substance. So you can rank any law in regards to a product or service by the quality of the substance or service, access to the substance or service, price of the substance or service, which is directly linked to the quality, and then true social impact, something like amnesty and expungement. So we're done with the drug war. Everybody knows it. It's just how is it going to break down at this point?
Thank you.